Now we're going to go into the latter part of the session today, which is led by my colleague Marie Kerwin and our panel, who are going to be talking together about genomics. As I say, we can see that there's a slider that's appeared on the screen. If you wouldn't mind just undertaking or clicking on scanning the QR code, so that we can just generate some feedback on your thoughts about the particular question that can be seen at slido.com. I'm going to hand over to Marie.
Thanks very much, Barbara. So you are all very, very welcome. And this section of the roadshow is our Nursing and Midwifery panel. Now, we are really keen to give you our perspective, but more importantly, we'd like to hear from you. So if you can start to think of a question that you might have that you want to ask about genomics. Now, we are a Nursing and Midwifery panel, but we have got a multi-professional, multidisciplinary audience. So it really is a case of let's have those questions. So let's have a little think about it. So if you do the Slido for us, that would be really, really helpful, because it'll give us a little bit of a baseline of where we are. Because today, for the Nursing and Midwifery panel, we're called the TAG team. And we're called the TAG team because it's an acronym, and it's talking together about genomics. And our hope as a panel is that through hearing us talking together about genomics for each of us, it will inspire you to go out there and to start talking together yourselves about genomics. Now, we're calling this section Dispelling the Myths. Because as Wahida and I have been going round the region, we're hearing things like, oh, genomics is not for me, it's very technical, it's very niche. And that's what we want to do today. We want to hopefully dispel those myths that genomics isn't for you, because it is. And you will hear how and why from this incredible panel today. So without further ado, I won't introduce them. They're going to introduce themselves. But we really are incredibly lucky to have such a talented and diverse team of policymakers, researchers, educationalists, practitioners on the ground. So this is great. I think I might have forgot to say who I was. I'm Marie. Yeah, I'm just some random stranger who happened to pitch up and take this chair. So no, my name's Marie, and I'm one of the genomic nurse leads for the Northwest Greater GMSA. Oh, you've got your mic. You're mic'd up. Okay, thank you.
I'm Charlotte, and I'm a breast care nurse over East Lancashire Hospital Trust, and I take an active role in leading the family history service there as well.
So I'm Wahida Abbas. I work with my lovely friend Marie here. I'm based at Northwest GMSA. So I'm the genomics lead in midwifery in Northwest GMSA. And I have another role, which is cultural aids of midwives, which I do at Bolton Foundation Trust. And I try and blend both roles together. Thank you.
Hello, I'm Janelle York, and I'm the Chief Nurse here at the Christie. I'm also a Professor of Cancer Nursing at the University of Manchester. And a couple of years ago, or maybe 3 years ago, I was asked if I would be the Northwest Chief Nurse Lead for looking at from a strategic perspective of how we can implement genomics into everyday nursing practice.
Hi everybody, so I'm Mandy Philbin, I'm Chief Nurse for Integrated Care System in Greater Manchester. A bit like Janelle, although 2 weeks ago I was asked if I'd be on this roadshow around genomics, so I've definitely not got a research background or a long-standing history with genomics, but that's me today, thank you.
And I'm Joanne Kiernan, I'm a learning disability nurse. I currently work across 2 areas. I'm a senior lecturer at Otago University, so I have some research experience. And I'm also the consultant learning disability nurse at Old Hay Children's Hospital. And I met Jill Moss, and that was my first mistake. That's why I'm here.
Absolutely brilliant. And just as a point of reference, what you are looking at here now is 185 years of experience of nursing and midwifery. And today's my anniversary. 35 years ago today I started to become a nurse. So with that, thank you. Thank you to all my patients. Okay, so dispelling the myths in you. What we thought we would do in this conversation about talking together about genomics, this tag team, we're literally just going to go through the panel and we're going to ask them, what does genomics mean to you as a healthcare professional? And hopefully that will spark some inspiration inside yourselves about what you could be doing in your own practice. So, Janelle, as our host today, would you be happy to go first with what does genomics mean to you as a healthcare professional?
I will, and I had a few sentences prepared, but I'm scrapping all of that, and I'm just going to actually say what's in my mind now, which is I've already heard since I walked in here 10 minutes ago that genomics is the future, and I would actually like to say it's here and now. All I hear is the amazing patient stories of how genomics has absolutely transformed people's lives, especially in the area of oncology, in cancer. Personalising chemotherapy treatments has absolutely transformed the way that we care for lung cancer patients in particular, and that's mostly my area of interest, is in lung cancer. So it's really transformed patients' survival, patients' quality of life, and has given us options. And as a leader in the NHS, it's my role. I'm not a genomics expert, far from it. I keep meaning to go and do a course one day, but I haven't got around to it. But there's plenty of experts in the room. My role is to provide the facilities, to facilitate education, to facilitate training, and to give nurses, midwives and allied healthcare professionals the skills and the tools that they need so that they can embed genomics into their everyday life. And again, that's not about everyone being an expert, but it's about being comfortable enough to have a conversation with a patient and or family and knowing where to signpost people to. And we now have genomics as a set curriculum in the undergraduate nursing degree as well, and that's been signed off by the NMC, the Nursing and Midwifery Council. So again, I would say it's not of the future. I mean, goodness knows where genomics will be in the future, but it's definitely here and now, and that's my take-home message.
That's brilliant. And so it's exciting to be part of that, isn't it? No matter where you are within the multidisciplinary team. Yeah, brilliant. Thank you, Janelle. Hello, Mandy. Can I go to you next, please?
You can, yeah. And I think it's an opportunity to stop doing more of what we're doing. So I work in integrated care system, very much around performance-driven, A&E targets is what we talk about, waiting time, 62-day waits. We've got to pack that in. We've got to think differently. And I think this is already coming. You mentioned it's like a roller coaster, but actually it's a change of mindset. So we still talk about performance and targets and driven through an NHS. We've got to change population's needs to actually change what we talk about in future, and changing or allowing people to have an option and a choice around what they want to do from a healthcare provision, but also that choice around when do they want that to happen. And genomics is facilitating that. So I see this as it is an opportunity, but very much an opportunity to change a mindset. As a diabetes specialist nurse background, for me, we should have been doing this a long time ago. We wouldn't have then been in peak pressures that we've got now, that we just can't manage in anymore. So at some point, there's going to be a tipping point, and this really is a way into that, is how I'd describe it.
That's absolutely brilliant. Thank you so much. Joanne, are you happy to go next?
Yeah, absolutely. For me as a healthcare professional, and I hark back to Bill's session first thing this morning, there's something about inequalities here. And for me as a learning disability nurse, you're talking about one of the most vulnerable populations. We've got key issues in that population. We've got premature death rates from avoidable causes, 23 years. A man with a learning disability on average will die earlier than a man without a learning disability based on a preventable cause, and 27 for females. We're in 2023. That's really quite shocking. I don't know if anyone else is shocked by that. But actually, we've got other big issues. We've got polypharmacy, the use of antipsychotics, over-prescribing. We've got huge strategies going on across the NHS. And a little bit like Mandy's saying, I can't understand why we're there. I don't understand why we're there when we know what we know. And actually, accessing healthcare for the groups of people with a learning disability and or autism is quite tough. We're tough to get into. We're tough to deal with when we've got them with us and they struggle to get into our services and get equitable healthcare. So for me, some of the developments in genomics are about ensuring that some of our most vulnerable populations get the very best at the very earliest time in their journey, and that we don't spend thousands and thousands and millions of pounds on getting it wrong for this particular population who actually have a poorer quality of life but also cost a fortune while we're getting it wrong and we're not doing what they need. So my role is to support equitable access of healthcare for people with learning disability and autism and bring them with us on the genomics journey to make sure that they are part of the discussion around how we make sure they can access their care. And that's our role to do that. Sorry, I was on a bit of a soapbox. I apologise.
I think it was a fantastic soapbox, though. That's the thing, and I think it resonated. You know, you could feel it hitting that spot with the audience here, and especially if you are watching on the catch up with our video off the website. You know, you can feel that energy. Yeah. So some of the things I heard there were absolutely amazing, but we talked about need and we talked about the patient needs. And being able to respond to that. So I'm going to now come to this side of the panel because we've got people who have been on that journey of learning fresh about genomics, and it'll be good to hear what it's like at the ground level when you are actually patient facing and how you're addressing genomics in those spheres. Wahida, can we go to you first, please, as a midwife?
Of course you can, or a midwife. So for me, what I find fascinating is some of the midwives, when they come in contact with pregnant persons, carry out risk assessment, which they call a booking visit, and they ask important screening questions. But the issue is with that is they don't think it's anything to do with genomics. But of course, it has everything to do with genomics because we have so many screening programs during the antenatal period, then obviously neonatal screening program, and if they're high-risk pregnancies, you know, offering a prenatal diagnosis, and that is all genomics. But when I work in the community and speak to the midwives, did someone just say yes? Oh, sorry. It's okay, I thought someone would get excited I'm speaking. So, lost my train of thought. Yeah, so when I speak to the midwives, so what do you know about genomics? And the first thing they say is, I don't know what you're talking about. And the problem is here that we need to educate, you know, the senior midwives, because obviously if you don't educate them, it's going to have a knock-on effect, and then you want to approach at the bottom end where you've got your students and you've got your newly qualified, and then if we educate both sides, you can meet somewhere in the middle, and you've created that workforce who's got a basic knowledge of genomics. And what that means is it's improving, you know, pregnant persons' genetic literacy, personalisation of care, also looking at the family, looking at preconception care for future pregnancies. I could carry on. But
I hope you can feel the passion from this panel about genomics, and I loved what Janelle said about, you know, it's not in the future, it's here and it's now, and it's about how it's going to impact everything all of us do. I'm now going to come to Charlotte, who Charlotte and I met originally by doing a genomics course, and that's how our journey started into genomics. So I'm delighted to be able to ask you, Charlotte, as a health professional, what does genomics mean to you in your practice?
So as you said, Marie, we met on a course doing genetics. So as I said, my background's breast care nursing, so I did the general breast care nursing, surgery and things, and then I moved into family history. So that's when I took genetics as such, and it'd been there in the background but more related to family history, and that's where I kind of thought it sat just with the family history service. The rest of the other is a separate entity with breast. And then the more I've learned through genetics, it's like, oh, well, it fits every bit of my patients. Not, and I am biased because I'm just breast, but it fits every bit of breast. And then when I'm speaking to my other colleagues in cancer services, it fits in every part of theirs. I'm thinking, as my other colleagues have just said on the panel, why were we not doing this before? Because I can't see how we've not been fitting it in, because it is so across even our breast screening, our oncology, it fits every part, not just our family history as such.
Yeah. And we were recently on a roadshow in Lancaster, weren't we? And one of the things that was said from the audience was that a nurse was looking towards mainstreaming something called Lynch syndrome testing for colorectal and endometrial cancer pathways. And she said, you know, it's frightening to be able to take that step. So that's how this whole thing came about, that we wanted to dispel the myths, particularly for nursing and midwives and AHPs, that, you know, genomics is for you because it's for your practice, it's for your patients, and you can transform patients' lives. So going back to what you said there, Janelle, you heard the comment, you know, genomics is the future. Can I then ask you the question is, where do you see the future of genomics for the health professionals?
Well, really exciting, but I think nursing is the biggest workforce in the NHS, so embedding this into everyday practice can't happen without nursing, for one, because we spend the most time with patients and families, and there's so many opportunities, so many potential touch points where you can have a conversation about genomics. But of course the implications for midwives is absolutely phenomenal, and that can transform family care. And our AHPs have a vital role to play as well, because they're quite often involved with patients and families at very intimate times as well. So if we're going to make this work, we all have to work together, and we're all nurses sitting here, but you know, we can't do it without the support of our medical colleagues and of course all of our AHP and midwife colleagues. And as I said, it's already in the undergraduate curriculum for nursing. I don't think the G word was ever said when I was an undergraduate nurse back in the late 1980s. It was just something that you didn't talk about. It was more to do with family genetics, which always seemed quite niche and sometimes would have a negative connotation around the conversation with genetics. And I think that still exists, and in our learning disability patients as well. So I think we've still got a lot to go to actually break down the myths and to bring it into routine practice. But days like this really, really helps to move us that extra step forward, because I think the future for genomics, yes, it's here and now and it's amazing, but we're only just right at the tip of that iceberg, aren't we? There's a whole ocean underneath what we're actually doing here today for our patients. So it's absolutely the future, but let's not forget that we need to work with it in our everyday practice today as well.
That's brilliant. And I'm struck with, you know, when I think back to some of the presentations that we had today, you know, you could have had a patient as a nurse with breast cancer who had the DPYD variant, who had a poorer outcome. And it's almost that you can build the picture about the difference it's going to be making, isn't it? Mandy, what are your views on the future from your perspective, from an integrated care and system?
So I think we've got an opportunity to make it real. So I've sat here this morning listening to John in particular, who gave me many equations on that board, gave me a pathway, and that's scary.
Yeah.
So as a nurse, I completely can blank off to that, because I'm like, I don't really know what you're telling me. What I admire is the brains that make that happen. But what I can do is translate that into a real patient. So we've just been talking around LD, for example. If I said to a LD patient or their families, have some genomic testing, they'd be like, hey, what? So I think the opportunity that we've got now is that implementation phase that John described, whether that's around medication management or whether that's around specific testing or avoidance of ill health in future, and making it real for patients, working with that engagement part to understand the language, what matters to them, because I know patients probably wouldn't ask about the impact for them. They'd be saying, how do I help my family? As a mum, I'd be thinking, what about my kids? You know, so how do we make that real and translate it? And I think that's the opportunity that as professionals, and I'm not just talking nurses, I mean all of us, as professionals, I think it's how we convert it into a realness, bringing science, evidence-based practice into reality. And I think that's an exciting opportunity.
Yeah, brilliant. Joanne?
Yeah, I think Mandy's right, and we've been quite inspired this morning, haven't we? And admiring the speakers and the level of work that's going on. Moving forward, we've really got to gain the trust of the people that we support in order to help them understand what this is about. Again, talking about learning disabilities, some of the staff who support people with learning disabilities are frightened of genomics because there's a feeling that it's about eugenics. It's about getting rid of things that shouldn't be there and the value of people. And we've got a lot of work to do to gain trust with people who aren't necessarily, we're not their favourite people when they come to hospital, when they come to see health professionals. They don't have the best experiences. And then we offer something that's going to screen you. And we need to be really, cognizant of that language. And the answer for that, for me, is that co-production, is that we go to people with lived experience of all, lived experience of dementia, lived experience of cancers, and ask them what they want and need and how they want that. And I think the conversation this morning, someone talked about not bringing people to hospital. We need to go to them. We need to be going to those communities. We need to be talking in schools. We need to be talking to people about there's a possibility here that you can improve your own lifestyle and healthcare by knowing some of those things about. But if you're a person, and particularly in paediatrics at the moment, diagnosis is really tricky. And those of you who've been around a while, the global developmental delay is back. Yeah, as a diagnosis for people sat in systems for years, waiting for a diagnosis before I can access those benefits, access that type of education, get that extra support. So the future for me is going back to the people we serve and asking them what they want and need and how they want that, and us responding to that in a really meaningful way so that they're on the journey driving it with us and we're not health professionals telling them what they need. You tell me what I need and I mostly won't be doing that. That's just some of us are like that and I'm like that. Yeah, don't have that vanilla slice. Well, I'll have two, thank you. It's that sort of, actually, I've learned so much by working alongside people, and I shout out to children and young people. You'll know if you want a straight answer, you ask a child or a young person and they will tell you. Yeah, and I very recently did a piece of work with some children and I had a lovely animation. It was lovely. It wasn't lovely at all, it was absolutely pants. And somebody told me that. Said, it's pants that, Joanne. It's too fast. I don't understand it. It was a child-centred animation that we developed and spent quite a lot of money on, and done quite a lot of consultation. And then we took it back out to say, what do you think of it? And pants is the overriding phrase. So that's about the stuff that we've got to learn from and go to people and ask them what they want and need so that we're not doubling up on that and gaining trust. We've got some trust to get amongst professionals who are a bit fearful and protective of the people they support, but certainly amongst families and people. I think that's where we go. And I'm on it again, I'm sorry. Sorry.
Absolutely. And when I was listening to you, I thought back to Bill's presentation when we started this morning about the Genes for Health and that community engagement, going out to the people that we serve and asking them, what are your needs? Not saying, we're going to do this. Why? Absolutely. And listen, soapbox, brilliant. I love it. It's great. Brilliant, seriously. And it shows the passion for why this is important.
We've got to get it right. We've got to get it right.
Yeah. And you touched on there about equity and things like that. So, Wahida, can I go to you now about the future, as you say it?
Well, future and currently, to be honest, present, because obviously we know in the past it's been a separate division, with genetics being separate to midwifery. And for me, it's really important that all health professionals, including midwives, allied healthcare professionals, they have a basic knowledge and understanding of genomics. So for me, especially for midwife, I think we should offer basic mandatory training for every entrant who comes as a registered midwife, and then update it annually as mandatory training with latest research. And the reason why I say that, if you don't equip your midwives with the knowledge, it's going to have an impact on patient care. So we need to get it right. And at the moment, it's not working because, you know, we miss things. And these are critical red flags that we need to bear in mind and look at the booking assessment. How can we change that? How can we make the questions more appropriate that we can ask the pregnant persons, it is now, and their families, because if we get that wrong, it's going to have a knock-on effect for the future generations. So it's really, really pertinent. And also, for the healthcare profession, having appropriate resources that they can tap into. If there's nobody available on the shop floor, there is a link there where it's a go-to place and it's got all the resources on one platform.
So it's that accessibility to the information that people need. And
also for the communities, because if you look at some of the communities, you've got people who can't read or write English or any other language, but having resources available where it's transcribed in different languages like YouTube channels, so they can listen to it and understand it, and then they know how important it is. So for example, even in midwifery, it's important to educate them about having a cervical smear after having your baby after the age of 25. When I've gone in the community, spoken to the women, they don't think it's important because they've just had the baby. Why should I have that? And it's about educating the importance of it and the breast awareness. And I find that it's quite common in Black and South Asian communities. They don't feel that it's important to have breast screening or cervical smear screening. So it's actually even equipping the midwives with that knowledge, and they can educate, the service users.
Yeah, absolutely brilliant. And then it's a ripple effect then, isn't
Definitely.
it? That communities are then able to inform themselves and share that
that's
knowledge.
Right.
Yeah, absolutely great. So Charlotte, from your perspective, you're working in breast cancer, and I know that in a short period of time you've gone from starting your genomic journey to now transforming the service that you actually work in. What does that mean for your patients? What is genomics going to mean for them now for the future?
I think, as I said at the beginning of my genomics journey, it was just something, a course to support family history. It wasn't meant to kind of, as I viewed it, wasn't going to impact the rest of the breast service. But it's that kind of making sure that everybody's kind of got that little bit, and it's not, like Wahida said, it's not just everyone needs to do a big course, they just need that little bit of knowledge. And in the breast team, through doing genetics, then realising it does play a big part in the oncology, the surgery and everything. But also my colleagues, they've kind of shied away from it for the same reasons I did. And, I don't do family history. And it's like now I have informal conversations with them at lunch, and then it's got that little spark going of it's not scary. It's not, it is important, but not everybody needs to be a genetic expert. We just need to make sure everybody's well informed and it's on their radar to kind of get that conversations going, like you say, the little bit of learning that they're now moving on to do. I think, like I said, it's called Genetics 101. So they've kind of led their own learning through just those small conversations with the nurses, really.
So then when we think back to the title of the panel, talking together about genomics, that's actually happening at your place of work, in the service that you're running, that people are starting with that conversation. So that's quite a good tagline then, would you think?
Yes, definitely as well, because I think, as you've said today about it moving on to other people, I think because then I got on my soapbox about genetics and our trust, and then I'm kind of tagging every other tumour group in, and slowly working my way across, like you say, our CNS forums where we have CNSs across all the tumour groups. I'm kind of then saying, well, I'm doing genomics, and then it's kind of moving through their tumour groups as well. So like you say, tagging them in as well. So.
Yeah, absolutely brilliant. So I'll give you a little secret. This panel met 2 weeks ago for the first time together with a shared vision of being able to dispel the myths of genomics in you. We wanted to get that message across that no matter who you are, whether you're working in the lab, whether you're a nurse, midwife, AHP, physician, surgeon, that genomics in you matters. And it matters now and it matters in the future. And they came up, we co-created, they're talking together about genomics because that's where it all starts, and that's why the value of the roadshow is so important. So we've been talking together about genomics, and now we want to hear from you. So no matter what your question is, we would really like to hear it from you, our audience. So, and if you want to particularly address somebody on the panel, please just do so.
Marie,
Pop your hand up because we do have a roving mic.
Marie, while we're thinking, we did have a screen up before on what does genomics mean to you in one word.
Oh yeah, can we?
And it was really interesting to read the words that were up there.
Yeah, is it okay to go back to our Slido results with the what does? Yeah, look at that. So expensive, okay, personalised, access, health, present, knowledge, cost-effective, patient-centred care, essential. Okay, so the Slido is still open if you want to have a go. But Jess, you've got a question.
Yeah, I have got a question. I guess just even seeing the panel, the roles for the roles for nurses and midwives and AHPs are so diverse and so varied. And you mentioned about the undergraduate curriculum, but I guess we've got a huge workforce that's already missed. And I was just wondering what your thoughts are around the best ways for people to start. You know, maybe it's the Genomics 101 course, but I assume because the different knowledge that's needed in the different roles, the appropriate resources are different. I was just wondering what your thoughts are for anybody who's maybe in the room who's thinking, well, where do I start then? What should I go and do?
Yeah, I think it's a really, really valuable question. That. So Jess is asking about where do you start your journey, and it's very personal about, so for instance, Wahida, myself and Charlotte, we all started on a master's module that was all about genomics, and it really did help us to gain skills about genomics and how to have genomic conversations with patients, and that was critical. But before we started that, because that might not be for everybody, and it is free, by the way, and it's run by the HEE, and the applications are open right now. So there you go, that's a bit of a plug. So before we started that course, we were encouraged to do Health Education's Genomic Education Programme Suite of Learning, and these are bite-sized information pieces that we and Glenda and Holly, our educational leads within the GMSA, advocate as well. And they're bite-sized pieces of information, and they're called the suite of the little videos. You know, you could do them in your own time at your own pace, and they're called Genomics 101, and it's a great starting block. So what we've done, so we've just finished a national lung cancer project, and part of that, with working with clinical nurse specialists about what they needed, is we've curated an idea of where you start your journey so that people can go from basic overview of genomics or basic science and DNA and things, and go all the way through to, like, you know, massive online MOOC courses that last six weeks, or indeed go on to a full master's program. So there's a massive array of education for how you start your journey, really. So, yeah. And Janelle, you mentioned about the curriculum. Do you want to tell us a little about that?
It's obviously, as you can imagine, undergraduate curriculums are so full, so that the fact that the NMC have now included a small section on genomics is fantastic, but it's going to take years, isn't it, for that to come to realisation. And as I said in my first sentence, it's here, it's now, and we've got to find ways of disseminating genomics into everyday practice. So that's a real challenge, and that's part of why the GMSAs were set up, why the nursing and the midwifery and the pharmacy groups were set up at national levels, to see what can we do in the here and now to start to educate our currently registered staff, just enough to have a conversation, a simple conversation about genomics with patients and with families, and to be able to signpost, because we already have very specialised genomics teams, nursing teams already who specialise in this, and they will already have their masters. We're not talking about them. What you're getting at is the people that are on the ground, and that's exactly what this event is all about. And a lot of the objectives of the GMSAs across the country are about how do we get this into everyday practice, and having the bite-size HEE learning modules is an absolute great place to start. But we need to start having the conversation amongst ourselves, don't we, and setting up seminars. And I think the Christie, for example, I mean, I'm looking at you, and I'm looking at both of you, actually, because I think we need to get together after, don't we, because it just has such huge implications for what we do here at the Christie. And I think we are quite good at it, but that's more coming from our medical colleagues, and I think we've got a lot of work to do on the ground with educating our nurses and AHPs, just here at the Christie, which is a cancer hospital where, it should just be already embedded, but it's not, and we've still got a bit of work to do there. It's a very big question, but if you've got some bright ideas as well as to how we can make it more accessible, it's a big ask, isn't it? It's a really big ask.
Yeah. Does anybody want to add on?
So I think I want to put a question back to you.
Because
actually, we've just described, haven't we, genomics, history of genomics. It's a ripple effect. So you started with a bit of an interest, but influencing bigger and wider. We need it to be a tsunami. But actually, your question to us was, what is it that we need? If you wanted to walk out of here, back into your practice, what would enable you to influence change? Because that's what we need to unlock. So I don't want to put you under the spotlight, but what do you think it'd be? What would really help you in your day job to make a difference? Watch a bit lead genomics woman for Christie. Watch this.
I probably should have introduced myself, shouldn't I, Marie? So I'm the pharmacy lead from the GMSA.
Well, there you go.
I'm asking all of these questions in pharmacy professionals.
Yeah.
But yeah, I think you're completely right. It's about identifying what people actually need to do their day job, isn't it, really? And how they can support patients and finding out what that bit of knowledge is. So, and it's different for everybody, but
it's different for the different disciplines. It's what a pharmacist needs is going to be similar, but also very different to what a nurse specialist or a nurse on the ward might need. So it's not just differences in disciplines, but it's difference in the area of focus within the disciplines themselves.
Yeah, and the specialisms as well.
And the
specialisms. There might be much more overlap in what an oncology pharmacist and oncology nurse needs compared to their counterparts, same professions, in another discipline, in another specialism. Rather.
Very true.
Well done, Jess. That really got the panel going, that question. So, and similarly, you started your journey very early on, didn't you, by that professional curiosity? What is genomics all about? Have you got a question?
Yeah, it's kind of like following on from Jess. My thing is like the HE modules are amazing, and like I always would recommend them. But how do we engage those people that turn around and say, well, it's not relevant to me? I think that's the biggest problem, is because those modules are going to be great if we've got people that are really willing to learn and really willing to broaden their horizons and like mainstream genomics into the care that they're giving. But how do we get it's that small first step, isn't it? I think that's the most challenging in my Macmillan role at the moment as a genomics fellow. Like, that's our biggest challenge, is how do we get people to want to learn about genomics and want to realise the importance of it. So that's my question to you. It's like, how do we do that to those people that are like, no, it's not for me?
I'm tempted to go to you, Charlotte, because that you've lived that, haven't you?
And I feel like, as I said before, it was kind of, genomics was my bag because it was family history. That was nicely boxed off. And to kind of get all the other breast care nurses that were very fearful of it to then start saying, oh, well, just do your genetics 101. That would never have happened, I don't think. I could have said, oh, it is for you and do genetics, and it just wouldn't have happened because they'd have still said, well, I don't do family history. And so I think we've had those very informal conversations, or like you say, we've talked about, especially there's new drugs in breast cancer that do need the BRCA testing. So then we flipped it, oh, well, you're in oncology today. Oh, well, do you know that drug? Well, it needs BRCA testing. And it's kind of reversing it sometimes, not starting with the genetics and kind of them switching off. It's kind of starting with kind of their fail-safe of the chemotherapy drugs that they're used to, and going to oncology clinic and saying, well, actually, it needs the BRCA testing. So, and then starting their journey from that point as well. And again, with the surgical clinics, we're kind of lucky in breast, I say, or unlucky. We've got a kind of post to go for Angelina Jolie, so a lot of our patients already come in with genetics in their mind. I know other services won't, but in breast, we always have that, even when they've not been diagnosed, about genetics, family history. So again, from a breast care nurse point of view, we can kind of reassure patients or refer them on, but have that little bit of knowledge because it relates to surgery rather than just family history or medications as well.
That's brilliant. And what I took from that as well is that, you know, you're creating those connections that people want to connect. And for want of a better phrase, you were talking together about genomics. That was number 4, I think, the time.
Sorry, we had a question.
Hi, thank you. Claire Williams, Bolton Foundation Trust. So I'm embarking, luckily, to have some funding to co-host a post over at Bolton. And I think it's exactly what you're saying. We're looking for a post for the cardiovascular aspect of the genomic work. And it's really how you've met, and I think this may be the slide that you were coming to about connecting and talking together. So how can I out at Bolton connect with networks to try and recruit and encourage somebody into this post? You know, it's very isolated for us, and I suppose today is around the roadshow and getting that message. I suppose my question is, could there be an email network exchange with people that have been here today to share that news, to work together, to collaborate?
Did you say you're from Bolton? Yay!
Yeah, I was just going to say, I didn't clock you from Bolton, but I'm going to just say we've brought one into Greater Manchester. Speak to Tyrone, but he's actually your boss.
Yeah.
He's your boss, so I don't matter about that. We're just that same conversation, very much around, we just need to do things once. Jill Moss is part of the group, she's not here today, but we'll speak to Jill and say, actually, Jill, I think there's a way that we can work together, because we only connected 2 weeks ago, but the common denominator is very much around just do it once. Yeah. And actually, if you're going to develop a patient leaflet, for example, if you're going to have a job description, if you're going to have a way that you liaise with patients or staff, or actually try and convert people, which is what you were talking about earlier. So we'll look at what opportunities that can create, and we'll be back in touch with you. And that's a promise.
Brilliant. Thank you, Andy. Have we got time for a couple more questions?
Hi. So my question's about how do patients access, or their relatives access, genomic testing? Is it something that's, you know, a standard set test depending on the disease, or is it something clinicians decide, or how do you decide to offer a test or refer for a test?
Who would like to take that question?
I can do it from breast.
I can, hold on.
The breast example?
Yeah, it'd be interesting to...
So we kind of have a 2-pronged attached. So normally, again, it's the classical family history route that we work out somebody's risk factors, and then that will engage us. But these people that are well women that come through our family history, and that's what they've been referred in with, just to see about their family history. That is a bit of a difficult clinic sometimes, because I think they come through with a family history and expect a genetic test. These are the ones that really want the genetic test, and sometimes it's about working out their risk and saying, well, actually, based on a number of factors, and sometimes people come with a big family history of cancer, but then when you've worked it down, it's both sides and things like that. So, and then they'll come through to our Manchester. We refer everybody on from the family history that's eligible for genetic testing. They come through to our regional genetic centre, which is Manchester. At East Lancs, which I'm very much part of, like Marie's mentioned, in rolling out the National Test Directory. So we're looking at testing our breast cancer ladies that fit a certain criteria, so it's our triple negatives, bilateral, and then also they get referred into us to work out the Manchester score if they don't quite fit that criteria, and then we are actually starting to do the panel testing at our hospital locally. So that's what we're doing with breast in East Lancs.
Is that okay?
Yeah, so I was just kind of wondering if patients are offered these, or do they have to kind of champion it themselves and access it themselves? And it sounds like it might work differently in each of you. You know, obviously maternal screenings are very different to how someone might access genomics in.
If I could give an example for Lynch syndrome, which is a rare pathogenic variant. Lynch syndrome increases an individual's risks, lifetime risk of developing cancer. We're currently, Jim's here and Mandy's here, are leading the... Oh, hello. So Mandy's our Lynch syndrome nurse educator, working with Jim Hill here. And it's about... So how that starts is it's about the patient pathway. So we're driving forward the change across the system that every patient with colorectal or endometrial cancer, their tumour is automatically, or as a reflex, is tested for Lynch syndrome. Okay, so that's one side of it, that we're, I suppose, empowering clinicians and patients that way. But quite importantly, and when we go on we do a series of webinars about Lynch syndrome, and we always start with a patient story. And we're very fortunate to have a patient story of somebody called Tracy, who lost a brother, lost a sister, got diagnosed herself with colorectal cancer, and nobody knew that there was a genomics connection. And she took that power of wanting to make a difference for herself and others to actually building something called Lynch Syndrome UK. So then we've got our VCSE side of things, like, you know, Macmillan driving awareness and things, so that we're coming full circle, really. I hope that's answered that, yeah. There's a couple of other questions.
Yes, yeah. First of all, there's a big thank you to all of you. That has been a fabulous panel, fantastic discussion. So I am Pilar Rivera. I am one of the respiratory consultants, and I am the lead of the familial pulmonary fibrosis clinic at Wythenshawe. I think it's based on all that we have discussed and what we are watching now and in the slide. I think it's definitely education is the key. Now I think in terms of education, I think it's starting that many of our colleagues, they are not aware quite great is the tool for the HEE. And that is simple thing, and that has been addressed very well on the survey that now is circulated. But I think it's to really achieve what we are thinking with the present and the future. My thing is that we need to inspire and empower people. If we put something as a mandatory, or something that is fixed as per regular, that will not inspire anybody. A big example is the mandatory trainings as part of NHS. And I think maybe I should not say that, but I think it's a reality. So I think so they need to be motivated. And how? Maybe I think it's identify people like you, all of you, I think in each hospital, each department and service, that they have, I think, is more experience, and they can put very clear the clinical applicability and put the patient in the center, and also what will be the benefit for the patient. It's not only for the academic purpose to know what is if it's any pathogenic variant or if it's something. No, if the patient will get any benefit for that, and then if first degree relative for somebody else will. If the answer is yes, then that is started for this simple dichotomic question that will inspire some people. And after that, gradually, there needs to be a journey. Cannot be, I think, it's just in a weekend to do everything. And then I think it's to put some examples all the time to keep that connection between what is the theory and very good courses that we have already and how we can use this knowledge and develop skills. And I think if we identify these highly motivated colleagues that I think is in each hospital department, that could be a good start. And work together. We need a lot of teamwork. We are not pretending to be expert about genetics. I am not. But I think that is a continuous journey and we need to keep updated the knowledge. And also I think is to keep the motivation. And one of the key things definitely is to see with the stories of the patients, videos, how we can definitely change life. That would be as a suggestion.
Yeah. That was absolutely beautifully articulated, and I'll just share that the update of the patient story is that this individual lady fought. So the guidelines were currently that you didn't have a surveillance colonoscopy until the age of 25. When her son was 16, she advocated for him to have, and he was found to have polyposis. So, 9 years later would have been a long time to have waited for that individual. And that's the reality. And that's how you can impact patients. So, yeah, I love what you were saying. Yeah. Can you just put your hands up if you are already involved in genomics in any way, shape or form in your practice? 2, 4, 6, 8, 9, 10.
Formed audience.
Oh, Bill, I'm glad to see your hand went up. It's always good if the boss puts his hands up. Okay, lovely. And then just a quick show of hands, please, for who would like to get involved in genomics? Excellent. And for everybody else who didn't put their hand up, why? No, seriously, that's been lovely. And hopefully we have what we said we would do. We've dispelled some of the myths. We've had an absolutely phenomenal panel, from incredibly valuable individual nurses and midwives who understand things from a system level, from an educational level, from a research level, from a practical level, about delivering the change to patients. So we can't thank you enough. We are going to ask you to have another quick go of Slido, because we are now going to see if there was any change between how you felt about genomics before the panel and now after. So on a scale of 1 to 10, how confident are you about genomics in your clinical practice? And for those of you who haven't got a clinical practice, in your role, whatever your role is, because it's an incredibly important role. And I would like to hand over to Bill. Thank you, panel.
So I'd just like to say, first of all, apologies for stepping out, but I can explain what I was up to. I was speaking to the Shelford Group. So the Shelford Group is an organisation of the 10 biggest hospitals in the UK, and they were very keen to find out what we're doing in genomics. So it goes back to the point that I made right at the beginning, sort of saying how important genomics is being seen. And at the same time, recognising that it's not the whole answer, but it does have an important contribution. We're now able to do genetic testing in a way that we obviously weren't. Patients are coming to us with more questions about genomics than they ever were. They're far more informed. They've got access to all sorts of information. And we shouldn't be put off by that. And if we are going to really achieve what we need to personalise, to improve healthcare, it's incumbent upon all of us to try and work out what bit we can contribute to that. And there are only 200 clinical geneticists in the country. There are only 300 genetic counsellors. We are not going to be able to deliver healthcare. And most patients don't want to come and see us. It's not appropriate for them to come and see us. It's an extra appointment and it's an extra visit, and if we need to see them, that's great. But actually what most patients want are to be seen by the person that's seeing them, by their GP, by their midwife, by their nurse, and be able to ask a question and either get an answer which helps them to understand, or to get signposted to the right place. To, if you don't know, and if you're asked something and you think, yikes, that seems a bit complicated, please feel that you have a point of contact with us in the genetic services, that you can contact us, email us, ring us, ping us a message, and we will get back to you. And it's only by asking those questions that you will get the information and feel supported in that. When we started the point of care test programme that I mentioned right at the beginning on the neonatal unit with the little cheek swab, within the first, we undertook a training programme with the nurses. So there were about 80% of the nurses on the unit that had undergone some training. So they knew how the machine worked, knew what to do with the result. It wasn't about making them an expert in all of genetics. It was about providing them with the knowledge so they could do the test. Within the first week of starting the whole study, they identified a baby who had the genetic change, gave that baby a different antibiotic, that baby didn't go deaf. And through the whole of the rest of the study, we recruited hundreds and hundreds of babies. We tested hundreds and hundreds of babies. We only missed 6. The reason we only missed 6 was because the nurses absolutely took that responsibility. They saw how important it was and they took ownership of it. That it was for them to do. They weren't relying on anybody else. They weren't saying this is a research study, it's just something that Bill's interested in. They were saying this makes a difference to these babies that we're looking after. And if you keep that at the core of what you're thinking, then you will find the way to get the knowledge that you need to deliver it in healthcare. So, thank you so much for coming. Thank you very much for the panel, to all of to George and to John who spoke earlier. Thank you all of you for just your engagement and your interest in what we're doing. And do go out, spread the message, come back to us and ask any questions, or any way you feel that we might be able to help or support you, do let us know. Thank you so much.